breakfast.
That smells delicious.
Live, 5 days a week. The Health Brief on the Journal.
It's 11 past 11. I don't know what significance that has. There's people that have superstitions with the clock striking 11 after 11. I'll just say it again. Maybe some good luck will rub off on me. All right, welcome to the Health Brief. Now, the global fight against HIV/AIDS is at a critical moment, I should say. The 26th International AIDS Conference is currently underway in Rio de Janeiro in Brazil, bringing together researchers, policymakers, health professionals, activists, and communities to really look at the progress made and the challenges that still threaten to reverse the gains made. To bring us some highlights and also takeaways from the conference, let me welcome my colleague on the line, Specialist Researcher at SABC News, Zandile Myeza. Zandile, a very good morning to you. Welcome.
Good morning, Ernest, and good morning to our listeners.
Indeed. So we're just about a day away. Today, the penultimate day of the 26th International AIDS Conference. Please take us through what's been happening at the conference thus far and some of the key issues that have emerged from the discussions.
Well, there's been quite a lot. It's been a loaded conference, but as a precursor to the official opening of the conference, there was some scientific highlights that were released, and we were shared. We were given the new survey that basically gave us an indication of the scale. It was the first large-scale survey on the scope of the PEPFAR disruptions globally. It's called the PEPFAR Pulse Study. And basically, this gave us a sense of to what extent did the PEPFAR funding cuts affect communities across the globe. And one of the compelling outcomes there was that about 52%, more than half of the implementation partners. So these are the organizations and communities that were responsible for providing HIV services to the people that need it most through PEPFAR funded programs. These are the organizations that had to shut down. We're told that about 52% of them lost one award, and others, their awards were terminated altogether. And this led to the closure of many clinics, drop-in centers, and service delivery sites in many countries. And it showed us that the loss was hardest felt by locally based organizations. So that was an interesting research study that came out just as a precursor to the conference. But one of the other big things that came out quite early on in the conference was a new report by UNAIDS on the backdrop of the conference, and it essentially warns that the reductions in international funding and cuts to HIV prevention and community services are likely to fuel a resurgence of the epidemic. And this caution in the report is informed by startling data that's in the report that shows that about 9 million out of the 41 million people living with HIV globally were not on treatment. About half of all children living with HIV did not have access to antiretroviral therapy. So in a nutshell, Ernest, what this report is cautioning is that without action, renewed commitment, renewed investment, they estimate that more than 3 million people could become infected by 2030. Sure. But these new infections could be averted if accelerated efforts and increased investment is put back at the center of the global HIV response. So those are just some of the very topical things that came out in the conference so far.
Yeah, quite concerning. I mean, new infections to the figure that you just mentioned now, 3 million globally, concerning enough. But how concerned should we be about the impact of funding, as we've just outlined now, and the pressures that puts on HIV programs, particularly on the African continent?
Well, it's extremely worrisome, Ernest, considering that the high number of new infections, that are recorded annually. We have an estimated number of how many additional new infections could occur if the renewed investment is not put into HIV. So this is particularly concerning because almost half of new recorded HIV infections in 2025 were recorded in sub-Saharan Africa, including the SADC region. So it is evident, it is clear that new HIV infections are rife on the continent. And the continent is also relying heavily, it's heavily reliant, about 90% reliant on international aid and international donor funding. And when the continent and many implementation partners or organizations were stripped of this funding, it then leaves the African region at risk of a resurgence of all the progress that has been made. To be honest with you, Ernest, the issue of funding cuts has been a golden thread running through the conference because a lot of the discussions are centered on funding. If you are going to accelerate the HIV response, money needs to be put towards that. And this is an issue that is coming at a very crucial time where there's scientific evidence and scientific innovations like lenacapavir that show that if you invest in HIV, it is possible to meet targets and improve population health outcomes. However, these innovations, these scientific innovations, are then met with funding cuts. So the HIV conversation right now is at a very contentious moment because there are scientific studies that are showing that things could move in the right direction. But in the same breath, there's funding cuts. How do you fund science? How do you fund research? How do you fund increasing access to prevention tools, treatment, and care? So it's a very concerning issue, the matter of funding, and it has resonated throughout the conference so far. It's at the center of almost all the plenaries that have been taking place so far, Ernest.
I can imagine. Now, with the conference concluding tomorrow, Friday, the conversation is not only about scientific advances and new approaches to HIV prevention and treatment, but also, of course, as you've just outlined now, the funding gaps and the most significant gaps that we will be getting into. As I see here, it also came very highly on the agenda. Zandi, we'll get into that and also focus on the positives that came out of the conference that you will share with us in a moment after this break. As a matter of fact, it's 19 past 11.
Africa's young innovators are leading the AI revolution, creating localized language models and developing smart solutions for the continent's biggest challenges. Join Channel Africa webinar under the theme AI is here. Is Africa's broadcasting ready? Then, on Wednesday, the 12th of August, International Youth Day, come join us from 10 till 11 Central African Time. Connect with global leaders and digital pioneers shaping tomorrow. Book your seat now. Visit channelafricawebinar.com. Channel Africa, the African perspective. The Health Brief on the Channel.
All right, 20 minutes past 11 Central African Time. On the line, I have my colleague, Specialist Researcher at SABC News, Zandile Myeza, just giving us some of the takeaways and concerns. And let's now focus on the positives that came out of the 26th International AIDS Conference, currently underway, by the way, in Rio de Janeiro in Brazil. Now, Zandi, what are some of the biggest developments or areas of progress being highlighted at the conference in the global response to HIV and AIDS in particular?
It has been extremely refreshing, Ernest, to see the conversations on the use of AI in the global response to HIV. That has come out quite strongly. There's some promising innovations in that respect. And the use of AI in global response to HIV speak to improving access to information on HIV and where community members can access the relevant healthcare services for both treatment and prevention. So we're seeing a heavy presence presence of researchers who are presenting on the use of AI to respond to the global HIV epidemic. It has also been very interesting to see a few developments around in the pipeline that will be shared later in the conference towards the tail end of the conference on long-acting HIV prevention and treatment tools. And this is particularly important because as the global community grapples with the second 95 of treatment initiation and retention, getting people on treatment and keeping them on treatment, it has been very refreshing and quite promising to hear that there are developments in the pipeline about long-acting HIV prevention and treatment tools. This is over and above the lenacapavir that we've spoken about at length. So the importance of this is that long-acting treatment options then mean that it will improve adherence. Where people struggle to take a pill daily, long-acting treatment options would mean that a person takes treatment for a period of time, and because the treatment is long-acting, they'll only take it again after a long time. And this is going to hopefully encourage people to stay on treatment, because there has been talks around treatment fatigue, where people are just tired of taking the antiretroviral therapy and they subsequently default. So long-acting treatment options are in the pipeline, and we understand we'll hear more about this towards the tail end of the conference on what's in the pipeline and what we can expect. I think the other thing that has been very interesting to see play out here at the conference is the heavy presence of regional interests for the African region on public health, on outbreaks, pandemic readiness, and HIV. There's been talks around Ebola and HIV right here at the conference. Yesterday, we also saw the International AIDS Society's regional members meeting for Africa, and it brought together IAS members from Africa to exchange regional priorities, best practices, and opportunities that align with the African region. There's been a lot of talk around domestic financing for HIV. How does the African region scale up its own HIV response? So that has been very, very interesting to see play out, Ernest.
Interesting, Zandi, that you say that the connection between Ebola and HIV. I'll be chatting in this hour to Dr. Vincent Muturi-Kyoy, who also gave a presentation in this regard. But as we wrap up, Zandile, was there any focus? I mean, I don't want to focus on the funding cuts, but it is a big issue, right? Was there anything mentioned, or is that coming up in tomorrow's session as the conference wraps up, of what interim measures, particularly as far as the African continent is concerned, what interim measures are going to be put in place to ensure that treatment campaigns continue and prevention messages are still put out there at the forefront?
Well, we'll hear that quite clearly this afternoon, Ernest. The Africa's HIV response after the PEPFAR disruptions. There's going to be a session today looking at the impact of the funding cuts on the African region. And the conversation is not centered on the problem. We've already identified the problem, but they'll be discussing solutions. And Kenneth Nguri, he's the IAS, the International AIDS President-elect. He will be moderating this session this afternoon, and essentially this is where a discussion is going to take place to basically iron out where to from here for the African region, now that we are aware of the extent of the impact of the PEPFAR funding cuts and disruptions on the African region. So that's what we can expect this afternoon. They'll be discussing solutions for the African region, and we look forward to that. We will bring you an update from the health brief on what came out of this.
All right, certainly a positive note at least to leave it on. Zandi, we thank you so much for that update and all of the good and the bad, I would imagine, coming out of the 26th International AIDS Conference. Thank you very much.
Thank you, Ernest.
That's my colleague, Specialist Researcher at SABC News, Zandile Myeza, here on the Journal, 11:25 Central African Time.
We are on Open Views Audio Bouquet.